Good evening and welcome to Health Check, your weekly medical show where we bring you specialists to talk about health and your wellness. Now, tonight we have a special episode dedicated to muscle pain, strains, tears, and weakness, among other muscle related problems that call for physiotherapy. Whether you're recovering from an injury, surgery, or managing chronic pain, physiotherapy plays an important role in helping you regain mobility and independence. To help us have this discussion tonight, we have Velma Mokeira. Yes, I had to get that clearly. Velma Mokeira, who is a physiotherapist ready to guide us through understanding physiotherapy and also giving us practical ways to reducing and preventing muscle pain. We are live on Facebook and YouTube. Our handle is at Top TV Kenya. And please share this link with your friends and anyone who will benefit from our tonight's discussion. And of course, start engaging us with any of your questions and comments. Our WhatsApp line is 0708 222 and our SMS line is 20933. Of course, begin your question with the word TV. Welcome to Health Check tonight. My name is Grace Mutisa. I hope you had a beautiful week. And let's learn together regarding the matters of pain and where you can get help. Allow me to bring Velma to us. Good evening, Velma.
Good evening, Grace.
You've had a good day?
A lovely day, thank you.
And you look beautiful in red.
Thank you so much.
Karibu sana.
Asante.
So introduce to us who you are, what you do, and where can people find you?
So my name is Velma Mokeira. I am a physiotherapist. We are situated at Hurlingham, at Hagwings Kodek Road. The building is Kose Heights. Yes.
Okay.
Yeah.
And who is a physiotherapist and what do they do?
Yeah, so a physiotherapist is a very important person to have in your life.
Yes.
Yeah, so a physiotherapist is a healthcare professional, yeah, who helps in management of pain, management and prevention of pain, injury, and disability. Yes.
Okay.
Yeah.
Pain, injury, disability.
And disability, yes.
Okay.
Yes.
Could you break it down for us when you talk about pain? What kind of
Yes.
pain? When you talk about injury, what kind of injury?
injuries,
And disability, which
abilities.
ones, for example?
So the pains, when you get an injury, of course, let's say you have had a fall or something like that, there's pain, of course, yeah? So a physiotherapist comes in to help you manage the pain, helps you to regain and be able to go back to your day-to-day without pains, yeah? So disabilities, we deal with people with, say, people with, sorry.
It's okay. Do you deal, maybe for example, do you deal with people who have spinal injury? Do you deal with
Yes.
would that fall there?
Yes, so that is what normally we deal with a lot of spinal injuries, low back pain, shoulder pain, knee pains, and all these other conditions, yeah? Things like arthritis, things like stroke patients that we do a lot. We try and rehab them back to be able to regain their independence, to be able to do their day-to-day without needing people to follow them around and just being back to being able to walk again and things like that.
Yes.
Yes.
What I've picked that you're saying, Velma, is the key thing as a physiotherapist. You want this person to get back to their normal life again.
Yes,
without
yes. And to be able to live a quality life. Yeah, quality life meaning with no pain or restriction to your movement, yeah? So I think the question I wanted to pose today is, are you moving poorly because you're in pain, or are you in pain because you're moving poorly? Which one is that? Which one is it?
A nice question to our viewers.
Yes,
are you
yes,
moving
yes.
because you're in pain?
Are you moving poorly because you're in pain? Or are you in pain because you're moving poorly?
Oh my.
Yes.
Hoping this discussion would help us define which of the two we are
Which
in.
one you're in, yes.
Velma.
Yes.
So it seems a physiotherapist plays a crucial role in one's life.
True.
And from your practice in our nation, have we really embraced the value of a physiotherapist, or we think it's not a crucial service that I need to sort?
I feel like we are getting there slowly. It's now getting to be known. Physio, before most people didn't really know about physio. Even now today, I still say I'm a physiotherapist and people are like, what is that?
Yeah.
So people are now beginning to understand. People are beginning to embrace it slowly by slowly. So we just need to get the information out there, more education on physio and matters with the conditions that we deal with.
Yeah.
Yes.
Okay.
Yes.
And our dear viewer, we are talking about understanding physiotherapy, and maybe you have a question or comment, and all this about pain, how to manage pain, how to get back to live a healthy life. Talk to us on our SMS line 20933, our WhatsApp line 0708 222 and of course engage with us at Hop TV Kenya on Facebook and YouTube. We'll be glad to hear your question, and of course Velma will be glad to respond to you. So could you share with us the different types of physiotherapy that we have?
Okay. So physiotherapy is really broad and wide, yeah. So we have orthopedic physiotherapy. That's where now we deal with mostly musculoskeletal conditions.
What is that? Take it down to Wanjiku's language, Velma. Velma.
So musculoskeletal conditions are just conditions that are, affect your muscle. Now, like the muscle pain we were talking about, yeah, and skeletal, like the back pains, because that happens from things like disc bulge. Yeah.
Disc, but is this your disc is protruding or something like that?
Yes,
Okay.
yes, because the spine, yeah, so in between the spine, the bones of the spine,
Yeah.
there's what we call the discs, just to help with the absorption of the pressure and all that. So sometimes because of imbalances here and there, the disc can get, bulge out of its position, so causing pain, yeah? So things like that. Orthopedic is just to deal with now all those mechanical kind of pains, yeah?
Yes.
Pains because of you're sitting for too long in the office, we are lifting heavily and badly, yeah? We're doing all these other things, even posture when you're standing, yeah? We have different postures that can cause all these conditions like
Standing.
back pain. Yes. So we have people who when they stand, things like sway back, yeah? So there are people when they stand, they kind of lean back, their shoulders, and then their pelvis kind of goes in an anterior, it rotates anteriorly. So things like that, just a change of that. Even some simple as people just standing one shoulder higher than the other.
Oh my.
The swag, yeah?
Yeah.
I remember, growing up, seeing all these people just walking with a
Bouncing.
swag, yeah, bouncing one shoulder, Over time, it creates a lot of imbalances in the body, yeah? So there are muscles that end up being overused and others are underused. That brings about a problem, yeah? So the body in general should have a lot of balance.
Yeah.
That's what we need. Balance. Yes. Not much of something, not too little of something.
Okay.
Yeah, yeah.
You've mentioned some very common things
Yes.
that one wouldn't expect could bring pain to you.
True, true.
You've mentioned about standing.
Yeah.
If you stand in a certain way,
Yes.
examples you've given could cause you pain.
Yes.
You've mentioned about lifting and sitting.
Yes.
Could you demonstrate to us some of the things that you do around there and it's just wrong, that could cause you to have pain?
Like sitting, a lot of people these days are sitting in a slouch kind of manner. Yeah. So when you're seated, you're supposed to
Kind of a posture.
Yes, yes, yes. So when you're standing, your shoulder, everything should be like a straight line. Yeah.
Okay.
Yes. So you're not back or you're not
but
leaning forward, because there are people also, because of different things, it could be pain.
Yes.
As most of the time, maybe when someone goes through surgery, sometimes they are tempted to protect the area. So they go into a protective kind of a pose, maybe lean forward just to feel like, oh, we don't want to stretch it out, yeah? So things like that.
Yes.
Yes.
I'm just thinking of a mother who's gone through cesarean section,
Yes, yes,
especially
yes.
first-time moms. You
Exactly.
know, you really want to shield that wound and feeling if I turn, it
Yes,
might
it
open up.
might open
So
up.
it's
True.
causing more pain, and maybe you'll be sharing with us some of the common. Was my next question. Some of the common complaints, or
Yes,
maybe help that people
yes,
come to seek help from your
yes,
office.
yes.
Could you just talk about that, especially as first-time moms who've gone through cesarean section and feeling I need to protect it, and later on there is back pain.
There
How
is
is
back
that
pain.
related?
Well, for moms, yeah, really it begins from the journey of pregnancy.
Yeah.
Because once you're pregnant, there's a lot of changes that goes on to your body, yeah? Not only physically, also things like weight. First of all, your weight increases. So your body, your joints have to carry more weight than they are used to, yeah? Okay, now as the tummy grows forward, what happens is you have to get balance. So your shoulders lean, and now the curve on the lower back increases.
Yes.
Yeah, so that you get balance, get all those women walking and we are leaning back and you're bouncing. Yeah,
Yeah.
so all those things, yeah. And now from that and the weight, yeah, it puts a lot of pressure on the joints and strains and causing strains and all that.
Yeah.
Now go back now, when we come now to the delivery bit of it, and maybe go through now a C-section, as you've said, yeah, because now when you go through a cesarean section, again, that's a point of weakness, yeah? By the time they have to do the operation, it takes time to heal, yeah? And of course, the core being an important and key muscle for the back, yeah? Because if your core is not strong enough, then again, you have back issues.
Yeah.
Yeah? And remember, because of the pregnancy, it's already been stretched out a lot, yeah? So did I go out of the question?
No, you're okay. You're explaining why the
Yes,
back pain comes for
yes,
expectant
from for
mothers.
expectant mothers.
Yeah.
And that's why it's important for physio, even to walk you through that journey,
Yeah.
to just help you reduce, because with all this that are happening, a lot of tension builds up in the muscles, and so that's why you need a physio, and also for just strengthening, yeah, to give you safe exercises to be able to strengthen your muscles, and not, not, of course, not the dangerous one.
Okay.
Yes, yes, because not every exercise is safe
Yes.
when you're pregnant.
Okay.
So that's why it's important to have a professional, to come in and tell you, oh, this is what you can do, this is what you can not do. Yes,
Okay,
yes,
so
yes.
it's okay for an expectant mother to see a physiotherapist.
It is very, very, very okay. It is very, very recommended.
Okay.
Yes, yes,
Sawa.
yes.
You also mentioned about lifting things.
Yes.
Where are we doing it wrong that is causing us to have some pain?
So most of the time, really, when you want to lift something, you just bend down, just straight as I have done, yeah? So most of the time when you want to pick something, or what you're supposed to do, especially when you're picking something heavy, you should go down, yeah? Do a squat. Not everybody who can, yeah? Now these days, because we are not used to doing that, most people cannot be able to do a squat, but you have to go down, bring the object that you're picking up next to you, then now come up.
Okay.
Yes.
Not bend.
Not
sort of
just
you.
bending over and picking it, because if
Okay.
it's too heavy, it will really strain your back. Yeah?
Yeah.
So we've had many people who just go pick and they can't even come up again. Yeah? Because now the muscles kind of just tighten up, or even the disc just bulges out of its position, causing you pain. Yes.
Okay.
Yes.
Okay. We've learned that. Be
Yeah.
careful on what you're lifting. What about lifting
Yes.
babies? You know, we just love our babies.
True,
and,
true, true,
you
true.
lift them up. and
Yeah,
they
yeah, yeah.
move forward.
Same thing, same thing. Anything when you're lifting close to you, close to you, because that gives you support. Yeah, not going and lifting from here. Yeah. So when you're picking, let them be close to you and just now lift up.
So bring
Yes.
the baby here.
Yes,
and
next
then
and now lift. Yes.
Okay.
Yes.
That makes sense.
Yes.
So what are some of the common problems that your patients present with when they come to visit you for physiotherapy?
Yes, the most common ones are back pains and joint pains, yeah? Things like arthritis, yeah? back pain, but back pain these days is the most of all the conditions, yeah. Because I think because of the lifestyle changes, yeah, people sitting for long again, as we mentioned, yeah. We sit in the office for too long. We get out of the office, we go to our cars, we drive home, we go again, we sit down at home. So all that exerts a lot of pressure on the spine, yeah. So leading to this. So that's what I've seen. Young people, especially now for young people, shoulder, neck,
Yes.
and maybe office people, computers, because of computers, yes, shoulder, neck, mostly just a lot of back pain throughout the spine, yeah. It could be the upper back,
Yeah.
mid back, or lower back. That's like the most common.
Yeah.
Yes.
Okay.
Yes.
So we are sitting a lot.
We are sitting a lot. We should at least get up.
Yeah.
Yeah. Don't sit for too long. After an hour, take a break. Yeah. Drink lots of water so that you need to go to the to the bathroom. If you can't remember. Yeah.
Yes.
At least that keeps you up. If you can do something standing up in the office. That's great. Yeah.
Okay.
Yes. Yes.
When I was growing up, it was said it's only old people who need to go and see a
Exactly.
physiotherapist, not
Yes.
young
Yes.
people. But
Yes.
it's amazing that right now the age has gone slightly lower.
Yes, yes, yes. Right now, even people, we say from 30, yeah, and then now these conditions that even now affect of course, the little ones, children from newborns.
Newborns.
Yes,
Talk about that.
newborns, mostly the conditions like cerebral palsy. These are conditions that are congenital, meaning that they are gotten either at birth, yeah? So whereby maybe the nerves have been injured, yeah? During the birth process or even before, yeah? During the pregnancy or
Yes.
even at birth, yeah? So when that happens, when the nerves are injured, it means that uh, now children are born with not being able to the sorry getting the word,
Just
yeah.
say.
Yeah.
We'll simplify
We'll
it.
simplify it. I'm just trying to get a very simple word, yeah.
Yes.
So when the milestones,
Yeah.
yeah, the muscle, they are born now with deficits, yeah, especially the muscles, they're not able to develop as they should, yeah. So they get a lot of their muscles, there's a weakness of the muscles,
Yes.
and the milestones are really, really delayed. Yes, yes.
So at least for them, they also need to come and see a
They need to
physiotherapist.
see a physiotherapist because
Okay.
now you are able to re-educate their muscles and just trying to make them to be able to live a more, again, normal, to near normal at least.
Yes.
Being able to be independent, that's what physiotherapy is all about.
Okay.
At least be independent, yeah? Being able to hold, to move, that is very important.
Yes.
Yes.
Okay.
Yes.
I'm hosting Velma Mokera, a physiotherapist, and today we are just understanding what is physiotherapist all about and how can you and I benefit from this excellent service. Do you have a question or comment? The numbers are right at the bottom of your screen. Engage with us, and for sure, in a short while, we'll be getting to your questions and comments. And please remember to share the link. We are live on Facebook and YouTube at Hop TV Kenya with any of your loved ones who will benefit from our discussion today. So, Vilma, what are some of the signs and symptoms that indicate somebody has muscle pain and inflammation?
So for the muscle pain, for you to know that you have muscle pain.
Yes.
uh, Muscle pain, of course, now you feel the pain, yeah. But inflammation, really, when you want to know you have the muscle pain and inflammation, first thing, of course, inflammation is there might be a swelling, yeah. The place will be tender, the area will be tender, and restriction because of the pain. Of course, now the movement will be restricted and all that. Yeah. So yeah, those are the common. Yeah, redness, the heat, the area you'll feel a bit of heat, or even fever for inflammation. Yes. Yes.
And what are some of the body parts that could have these muscle pains? At times you could think, I'm just okay, it's light pain, so I don't need to. But it could be something serious. What are some of these areas apart from the back? Of course, the back is normally utajua
Uh,
seek help, but there are other areas maybe in your practice you've noticed, hey, this person assumed was having this symptom, but really it was this muscle that was having pain.
Joints, for example, joints, yeah. So things like a knee,
Yes.
yeah. Sometimes people, you can feel pain on your knee, and you get that when you go in, you assess and do all these things, you find that the knee really doesn't have much,
Yeah.
but it's only that maybe the muscle, like maybe the quads, yeah, the front thigh muscles are really pulling. So when it pulls, it causes a lot of pressure. So anytime you're trying to move, you feel like there's that restriction.
Yeah.
So the person is restricted, or you're in pain. Yeah. You feel the pain, but not really that. But the pain is not really coming from the structures of the joint itself.
Yes.
Yeah. So it's because now of the muscles around there, or the soft tissue around there. Yeah. Things like the ligaments or the tendons. Yes.
So it's a symptom could be someone else, but reality is a muscle that is
Yeah, also
strained.
like, yeah, that could be it. But also we have, sometimes you've seen even things like referred pain.
Talk
Yeah.
about that.
Referred pain is whereby you get, let's say you have low back pain, but it's not really coming from the structures of the back.
Yeah.
You check the spine, super,
Yeah.
the muscles, no much, but you get that maybe a condition nearby, yeah, causing the back pain, or the pain to radiate, or the pain is being referred. Sometimes even people with kidney issues,
Okay.
yeah,
Yes.
pain, when the kidney has an issue, it can refer pain to the lower back, yeah, things like that. Just sometimes the way we say, for you to know someone is having a heart problem, yeah,
Yes.
arm pain,
Yes.
right?
Yes.
We get that. So it's not the arm, it's coming from somewhere else.
Yes.
But now it's manifesting on the
The
arm.
arm.
Yes. So there are all these kinds of things, and that's why you have to really assess and break it down and see what is really causing this pain.
Yes.
Yes.
Okay.
Yes.
That's very informative, Velma. And you know, at times we say, unajikaza, hii pain,
Kujikaza na hii
I wouldn't come and see Velma. Inajikaza kisabuni,
Yes.
as would say. So at what point should a patient say, hey, Baze, this one, I really need to go and see Velma for help?
For real.
Yeah.
Yes.
Because I
So,
know with Jikaza, we take some painkillers,
killers.
maybe some spray to help, but
Yes,
still the
yes,
pain is
yes.
there. At
So,
what point should one see a physiotherapist?
any pain that is really persistent, yeah? Persistent meaning you've done your painkiller, it is gone kidogo, now it's back, yeah? So any persistent pain, yeah? Pain that is not resolved even with rest, yeah? Because there are pains that are resolved with rest.
Yes.
That is maybe, now that could be because of, you've of course worked today, you've been up on your feet for too long, your back is feeling all this, yeah? But when now pain begins, like even now when you're sleeping, when you're resting, when the muscles and everything else should be at rest, you're still feeling the pain, that you should come and see us immediately. Yes.
A persistent
Yes,
pain.
persistent pain. Because when, especially pain that does not go away with rest,
Yes.
that is now pain, could be neuropathic. Yeah,
Yes.
neuropathic kind of a pain, meaning that there are nerves that are being strained or injured. Yeah, that's the only pain that most of the time you feel it in the night, in the day, every day.
Yes.
When you wake up, it's there with you. When you go to sleep, it's there with you. Yeah, because when you're having pain, maybe from sitting for too long, or you poor posture.
Yes.
Yeah, that is when you're out of the posture, or when you just stretch it out kidogo and do a bit of exercises, you feel better, right?
Yes.
But now when it's insistent, persistent, there's nothing that is really solving this pain, come. But then don't wait, because physiotherapy should be a preventative also. Don't wait for us to manage the pain.
Yes.
Yeah, preventative. Come talk to us, because there we are able to tell you, okay, fine. From our assessment, we can say, okay, fine. You need to do this. You need to strengthen this. This is weak. You need to strengthen it. Work on this.
Yeah.
Let us release this, because every day, just from our day to day, yeah, our bodies go through a lot of strain.
Yeah.
Yeah, a lot of strain, yeah, and pressure, and even sometimes stress.
Stress.
Yes,
Stress
it can
because of
manifest
pain.
physically, yes.
Talk about that a bit
Yeah.
also.
Yeah, so stress, things like stress and other things like even stress, depression,
Yeah.
these other conditions also can manifest physically. Yeah, so you're in pain. We've seen people, they are in pain for sure, and you can see they're really in pain, but again, we come, we do our assessment, we try to treat, we are drinking, but it is not going well. The problem is where? Up here
Yeah.
in the mind, yeah?
Yeah.
So that's the importance of getting to know what is really causing it so that you're able to address it. Because no matter how much you do the physio, if some problem is in the mind, it will never go away.
Okay.
Yes.
Wow.
Yes.
Interesting.
Yes.
And I was just thinking, you mentioned some different issues that could cause us to have pain, either back pain or muscle pain. For ladies, we love our high heels, and that contribute.
Yes,
And
yes,
we
yes.
vary. There are those who really love the really
Very,
high
very
ones.
high
The others,
heels.
they just love viscous small. Can that
Yes.
contribute, or it's okay? And if we have to wear them, how should
I
we
feel
care
like
about ourselves?
I feel like the very high ones, the stilettos, no, really. But there's at least 2, 3 inches that you can wear. But again, not going by your day the whole day up on your feet on them. But just heels affect and can cause you back pain, yeah? Because once again, when you're on your heels, yeah? So what means the balance already has been distorted, yeah? So there has to be, you will have to do some compensatory movements, yeah? Like, of course, when you wear heels, the first thing we lean back, yeah? To get
Yes.
some balance, yeah? The way we'll walk, it will not be the same. And remember, strain, again, that will cause a lot of strain on the joints, yeah? Because the balance has been kind of altered with.
Yeah.
Yes, yes. So things like, yeah, the heels as you're talking about, crossing of your legs.
Oh, really?
Yeah.
You mean
No,
the
no,
stick?
yours is okay. Yours is okay. There's this
The
other
other ones.
crossing all
Oh
the way.
my.
So
Yeah.
that causes an imbalance. For men, having their wallets on their back pocket and sitting on them, causing all that imbalance and stuff. So it's just the small, small things we do from day to day without really knowing they affect us that causes. Because most of the time I see people, at the clinic come and say, oh, I really don't know what caused my pain. Me, I've been okay and all this. But so such people who they are like, oh, did you fall? No, I didn't fall. Did you have an accident? No, you didn't have an accident. So you get, because of the every day, how you sit, when you go, you sit, you're doing all these things, lifting and doing all these things in the way you're not supposed to be doing, gradually builds up until one day you're just going to pick up and you're not able to come up. Yeah, and you're like, my back is sprained, and yes.
Okay.
Yes.
Interesting.
Yeah.
I'm hosting Velma Mokeira, a physiotherapist. You're discussing about understanding physiotherapy and how we can benefit from this great service. Do you have a question or comment? Talk to us. Our SMS line is 20933. Start your question with the word TV, and you can also WhatsApp us on 0708 222 And of course, on the comment section on Facebook and YouTube, our handle is at Hope TV Kenya. We'll be glad to get to your questions after this break. Keep it right here, and as you wake up to go and take that cup of tea, please wake up well. Take care of your back. We'll be right back.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Check right here at Top TV. Look and Live. My name is Grace Mutiso. I'm hosting Velma Mokeira, a physiotherapist, helping us understand what physiotherapy is all about and how you can benefit from this excellent service. And I hope you're learning a lot the same way we are learning right here in studio. Remember, you have any question or comment, engage with us. The numbers are right at the bottom of your screen, and we'll be glad to get in touch with you. So, Velma, as you're doing your practice as a
Yes.
physiotherapist, are there any other close specialists that you work with? Yeah, let us know about those.
Yeah, we do. There are a lot of specialists. I mean, in the medical field, you cannot really work alone, yeah? From, of course, the GPs, from the orthopedics, yeah, to chiropractors. Those are other people that we really work closely together because they come in to just help in alignment of the spine, yeah, as we are working all these other things just to make sure the inflammation is on the low and all those. So yes, mostly chiropractors, I feel, and orthopedics. The X-ray guys, so because sometimes we treat and we are like, okay, fine. I think we need to see more. Maybe there's something that is going on, and we send you, and we are like, okay, fine. We need to get this imaging so that we now like really know, yeah, for sure, what is really going on.
Okay.
Yes.
So could you take us through the steps once a patient presents themselves to you? You know, so what are the steps towards helping them get better? Yeah. Like diagnosing and saying, yeah, now this is the issue you're having and this is the treatment plan we're having. Yeah.
So, I mean, it's all about. Did I get your question?
The question is, Grace
Yes.
has come to see Velma. I
Yes.
say, I'm having a pain here.
Yes.
So take me through what you'll do in terms of diagnosing what the issue is,
Yes.
and until you say, no, Grace, this is your treatment plan or this is your management plan.
So once you come in, of course, the first thing is taking your history. Yeah, we got to know everything. Yeah, from back there, any medical history that we need to know, because all these things, again, as we have said, they could be. The body is so much interconnected, and one thing could be leading to another. So we really need to understand so that we know where that pain that you're saying is here is really from here and not from anywhere else. It's not being referred or being radiated from another place, yeah? So we come in, we take your history, we do now, that's our assessments. It's different, yeah? Whereby we can check your range of motion, yeah? Trying to see if there's any movement that is restricted, if it's just the muscle, or if it's the joints, you know, because pain can be in a lot, yeah?
Yes.
A lot of things can be causing the pain. So we have to, yeah, so it's just through that assessment. Then after now you're able to find the diagnosis from the assessment, you know, okay, this is what we are dealing with. Come up with a plan, yeah? That's now when we come up with a plan, short-term goals, long-term goals, to at least now take you through, yeah? Yes.
Okay.
Yeah.
Thank you. I'll ask not to sample a few questions that have come through from our viewers, and thank you so much for keeping it right here and writing in. We begin with one of our viewers who says, kindly ask Daktari what is the best treatment for sciatica?
Sciatica.
Yes, sciatica.
Ah.
What's that, first of all?
Sciatica is a pain radiating down your leg, yeah? So most of the time it's caused by the disc bulge we are talking about, or a herniated disc, yeah? So when the disc comes out of its position, it causes pressure on the nerve roots, yeah? As the nerves are exiting from the spine, there's a pressure is put on them, and that irritates the nerve.
Yeah.
So you'll feel the pain from the back going all the way down to the foot. Things like not only pain, numbness, and kind of a tingling sensation, yeah? That is what sciatica is in short, yeah? So yes, sciatica, of course, we have to come, that's where we have to manage the pain through exercises and also now manual therapy, whereby now that's where our physio comes in to do techniques like, of course, we do the manual therapy.
What
whereby
is that? You know, you're doing this. I mean,
yes,
kanda or something.
yeah, something like that, but not that, yeah.
Yes.
Manual therapy is a lot, yeah. There's the myofascial kind of release, whereby you go and see if the muscles, because when that happens, most of the time also there's a lot of spasming of the muscles. So you have to make sure at least the spasm has let go, yeah. And then now through exercise, exercise again now is the key,
Yes.
yeah, because now you need to strengthen the muscles of the back and the core just to be able to keep you in an upright position, yeah. Then from there we try and do other manipulations just to help be able to return or to be able to reposition back to where it's supposed to be.
Yeah.
Yes.
Okay.
Yes.
So a physiotherapist is the person our viewer needs to see.
A physiotherapist is a person you're supposed to see.
Okay.
Yes. So that at least they are able to, do the manipulation, the manual bit of it, not able to really
Demonstrate.
get into it or demonstrate,
Yes.
but then again the exercise, and then now be able to now give you the correct kind of exercises to do. Exercise is very key.
Yeah.
Exercise, activity, all these things that we are getting these days is because of lack of activity. Physical activity,
Yeah.
is the number one cause. Yeah.
Oh my.
So we need to really, really work on that.
Yes.
Yes.
Physical activity.
Physical activity.
Okay. This one says, I was treated for the same in February, and recently I am having a persistent pain in my left arm. Could it be as a result of sciatic pain?
So they were treated for sciatica, and now they are getting pain.
Yes,
in their
persistent
arm.
pain on their left arm.
Left arm.
Yeah.
No, not really. Yes.
So what could be the issue happening in this viewer's life? Or what do they need to do?
You just need to come in, because now the arm and the sciatica, that's different. That's extremely different, because remember we have different sections of the spine. Yeah, different sections.
Yes.
So that it is not really like directly connected. I won't say because of the sciatica now you're getting the arm pain. Arm pain could be due to other things that now you need to investigate and know what is really, really causing the yeah.
Okay.
If it's coming all the way, it could be now another maybe, bulge or pressure, or the nerve is just being put pressure on from the nerves, but not from the nerves up here.
Yeah.
Yes.
Okay.
Yes.
Thank you.
Yes.
So please go and see a
Yes.
physiotherapist so that to
To
diagnose and it's
establish
not
that.
related.
Yeah.
Okay. Sawa.
They're not directly related.
Okay.
Yes.
Another viewer says, hello, health check. A question to the physiotherapist. I feel pain at the very back of my foot, the right one. At times, it is difficult to walk. When I skip it, it becomes worse. I tried massaging it, and it's more painful. What could be the issue?
So pain at the back, the foot, yeah? Is it worse in the morning? Because there's something we call spurs. Spurs on the calcaneus, yeah? So calcaneus is the heel, yeah?
Of the foot?
Yes, the heel,
Okay.
yeah? And sometimes because of, first of all, that one is mostly because of weight, yeah? When your weight is a bit too much,
Yes.
yeah, it causes a lot of pressure, and there's normally a lot of bone outgrowth, yeah. So what we get is like kind of a small spur. We call them heel spurs, or calcaneal spurs. When you step, you get pain, especially very worse in the morning, or when you sit for a long time, coming up, you feel a lot of pain, yeah, things like that.
Yes.
So what we're supposed to work on is just, of course, just, we can use heat cold. They can try, if it's a home remedy, just try heat cold. And then there are other exercises that you are able to do to be able to help with that. Yes.
You've said
because
heat
some people
cold.
heat like maybe a water bottle or something, hot water bottle.
Put it.
Yes, or
Okay.
ice. Just get maybe things like ice and just rub, just to reduce the inflammation. Other people who are exposed to this kind of a condition are people who are flat-footed. Yeah, because when you're flat-footed, you're not the weight. When we naturally have an arc.
Yes.
Yeah. So when that collapses and you stretch this plantar fascia. There's a fascia down here. When you stretch it on the foot, you know, it strains a lot and causes pain. That also could be part of it. So again, we have to establish what is really causing the pain, because it could be from that or even the calf muscle. Yeah,
Calf
because when
muscle is
yes,
behind
there's
here.
guembes.
There's
Yes,
guembes.
there's guembes.
Oh, okay.
So it could be the calf muscles, because when it's also tight, it pulls, because the calf muscle, the tendon of the calf muscle inserts on the foot below, yeah? So on that calcaneal bone. So sometimes when it's really tight and pulling, it can cause that kind of a discomfort.
Okay.
Yes,
Yeah.
yes, yes.
You know,
Plus, you know, in the clinic, we also have other machines that can be able to help. We have like ultrasound therapy, we have electrotherapy, you know, whereby we use like the TENS machine and things like that. We have different machines that can be able to help also manage that inflammation and take that pain down. And maybe now give you exercises to help. If the foot is flat, there are things that you can be able to do just to regain that. Yeah, yeah.
Okay. You know what I keep hearing? You see, Velma, exercise, 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 movements, movement really helps deal with pain. And somebody could say, I think one of our viewers alluded to, I try to massage.
Yes.
So, and I could feel some pain and just go and see a masseuse. Would that help? And what's the difference between the masseuse
Yes,
and
and
physiotherapy?
physiotherapy. Two different things. Yeah, physiotherapy, we go through this training, we get the anatomy, we get the pathology bit of it. When we are pressing on you, if we need to press on you, when we are doing pressing, I know some people, if you've gone through physio, you know it's not easy. When we are pressing, we know what we are doing. We know what we are doing. You know where you're touching.
Yeah.
You're not just touching anything and everything, because that's, again, the body is very sensitive.
Yeah.
You can touch something and, you know, it goes all wrong, yeah? You know the indication and contraindications of a certain thing, yeah? So that's very different, yeah, from just the training that we get. I'm a source, I don't know that kind of training, but I know it's for us, it's from a medical point of view. And we are able, you know, we are taught now, that's where you learn about the diagnosing, the assessment. You're able to know all the anatomy and why, because for you to be able to treat, you need to know why that is really happening, yeah? Why am I getting the pain on the foot, yeah? You need to establish the why. So, but someone who's not been able to go through training, of course, they'll be like, okay, fine, you're feeling pain, let's press, yeah? Yeah, so the best person to see is a physiotherapist.
Okay.
Yes.
Thank you about
Yes.
that. I'm
Yeah.
sure it's helped as many as possible
Yes,
who are
yes,
watching.
yes.
Maybe
Yes,
we're planning
don't
to go and
run
see
to
a
the
masseuse.
Yes, because, well, there are people, in my, you know, I've met, especially people who work out a lot.
Yes.
They're always like, you know, because of the working out and all that, the tension builds up in their muscles and all. So most of the time, you know, I meet people and they're like, oh, you know, I'll just go for a massage and all that. And most of the time, it doesn't really work. Yeah, I had one couple, for instance, who really made me laugh one time. They kept on telling me they always after the gym, because they used to work out a lot, like 5 days in a row, yeah. So they said, oh, need to get a massage. And they could go get a massage. By the time they are getting home,
Hey.
we are still feeling now all the fatigue. So they said, okay, fine, we'll just be getting this person to come so that at least we are able to relax. But, you know, I've gotten all this. I'm not spoiling for the massage therapist, but they're bad. Yeah, massage, unless you're just feeling like, you know, you just want, you know, but if there's an issue, the best person to see is a physio.
Okay.
Yes.
If I want to pamper myself, I go to a massage.
Yeah,
If I
once
want
in a
to
while you can
compare-
pamper, but yeah.
Okay, well,
Yes,
fine.
yes, yes.
So, take us through the journey of how to treat back pain, shoulder pain, neck pain, which you say the most common pains that patients come to see you for. So, how do you treat them?
Again, just through, we have, as we said, physio. We manage all these things through physical means, yeah? We prefer the physical rather than drugs, yeah? Painkillers, yeah? So physical, things like the electrotherapy I was talking about, the machines that we use that help with the management, myofascial release, now where we use our hands, what people cold massage or soft tissue manipulations, yeah, and also just manipulating the back and things like that. So it's basically that, and now exercise. Exercise is medicine.
Okay.
Yes,
And
yes.
can one come one time and it's done, or I'll need to come again and again until the pain is over?
Yeah, you need to, of course, after the assessment, we are able to tell you, okay, Grace, now this will need to have 5 sessions. We need 3 sessions of this to sort this out, depending on the condition again, yeah? Things like a stroke, for example, those are things like can take a longer time because it's nerves, and nerves take some time to recover, yeah? So that can go for long, yeah? But there are these other conditions like, okay, I sprained, I fell, I'm feeling this, I'm getting some hip pain and things like that. That we tell you, okay, these are 3. But even now, after you've recovered,
Yes.
maintenance, yeah? So that you come back, at least we say, for people especially who sit for long, at least once a month. If you're on your desk the whole day, I'm sure you'll not be seated the way you're supposed to be sitting the whole day, I'm sure sometimes you sit and you're swamped in your work and, it's 5 hours down the line and that's when you're like, oh my God, I've not even moved an inch. So that's why you need now to do maintenance, preventative kind of care. You don't wait for you to have the pain, for it to manifest, and then for it to be so bad. Most people wait until they are not able to walk. Then they're like, okay, now this is bad. Now I need to see someone. I need to talk to someone about it. Anytime you have pain or there's a discomfort, your body is trying to communicate. Your brain is trying to communicate. There is a problem. There is a problem. There is something that is going on. The earlier you attend to it, the better. Yeah? Because again, when you take too long, yeah, there are things like compensations that happen.
Yes.
Yeah, if today my knee is in pain, I'll start compensating. I'll limp.
Yes.
Yeah, so when I'm limping, there are muscles that I'm using, others I'm not using. Right? There's already imbalance.
Yes.
Yeah, so that's already. It started with a simple knee pain. Now it's gonna go, you find like now it's gone all the way. There's something else, another problem because of the compensation. So the earlier, the better. When you get this, when you start feeling, call or even call, ask. It's better to ask and, we are able to monitor it and you're like, okay, fine. If it gets here, this is what we need to do. Or maybe do this, do this. Yes.
Okay.
Yes.
Thank you.
Yes.
And do physiotherapists also help with the mental health condition? Because you mentioned at times it's hard. It could be a pain somewhere, but it's a mental issue.
Yes.
So are you also able to help a patient with that?
We help in the symptom management. I won't say like, again, as we said, root cause.
Yes.
The root cause of the pain. Remember, as I was saying earlier, that if the issue is in the mind, we need to address that. But of course, when sometimes it's in the mind, when people are stressed, we see there's a lot of tension. Blood flow is restricted, yeah, and all that. So pains, yeah, we can manage that. But again, that's why we need to get to the root cause of it so that we are able to manage it, yeah? Because again, we don't need you to come and we are dealing with the same thing and it's not going away. No. Because as a physio, I'm happy when I see you. You're telling me, oh, I'm getting this. And when I see you next, I'm like, Velma, I'm better. I can stand. I can sit. I can do this. I'm able to do what I wasn't able to do. Now that is more fulfilling, yeah? Then we come the next day, oh, yeah. 3 weeks later, oh, yeah. No.
Yes, there must be
yes,
progress.
improvement and progress over time.
Okay.
Yes.
So how do you support in terms of rehabilitation of patients who've gone through surgery or maybe those who have severe injury? How do physiotherapists now come in play?
First, in surgery, again, pre and post is important. Pre-surgery, meaning we prepare you for the surgery, yeah? Remember, as I was saying, when you're in pain, let's say you have hip pain today, yeah? So the muscles around the hip, you're going to avoid using the hip with the pain, yeah? With that, over time, there's a lot of weakness, muscle weakness that happens, yeah? So pre is whereby we at least try to take down the inflammation. We try to strengthen the muscles, because when you strengthen the muscles, It means like it will shorten your recovery time, yeah? So post, we help you. Now after you've had your surgery, we have to start to keep you moving. Remember physiotherapy, we have to keep you moving because there are dangers of just being, you know, not in motion.
Yeah.
Things like blood clots. Yeah, those are things that could happen, especially after a surgery. You could develop a clot, which is very, very dangerous, and it's a risky.
Yeah.
It's very risky, life-threatening,
Yes.
because once that dislodges, within a few minutes, it's done, yeah? So things like that. So movement and trying to just rehab that area by exercise, yeah? And just, you know, calming things down for sure, yeah? Because also surgery is a lot, yeah?
Yes.
And also the point of surgery, things like scar, managing the scar tissue, yeah? Because when the scar forms, that's now where the physio we do things like friction on the scar after it's healed, not when you're still fresh.
Yes.
So when you're fresh, we just keep you moving. We give you the confidence of being able to use that leg. If it's, let's say, the hip, you have to, you know, go gradually.
Yes.
You know, there's a time where we have to use the crutches, whereby you're not putting any weight. We take you through that step, and now we are like, okay, now we can do away with this. Now we can start using this to a place now you're able to stand and use that, the limb, the way you are using it before.
Yeah.
Yes,
Okay.
yes. So surgery is that. So getting you back, getting that confidence, because after surgery, most people are afraid to use that. Just giving them that confidence of, yes, we need to use, because if you don't use it, remember, the injuries could be overused or underused.
Yes.
Yeah, there are injuries because you're not using a specific, let's say, muscle or muscle group, yeah? You get a certain kind of injury. So it can be overused or underused. So that's why we need to now get you back, strengthen, and be able now to balance out, yeah? And against scar tissue, because when that scar is not worked on,
Yes.
what happens is the area is, blood flow is restricted, and it could be painful. And then the mobility of that area is reduced,
Yes.
yeah? So that's why you need to really make sure as it heals, the scar is also healing very well. It's not, yeah.
Okay.
Yeah.
Okay. And as we wrap it up in the next few minutes, so
Yes.
what tips could you share with us, Velma,
Yes.
that you can apply every day to help us avoid muscle pain or help us reduce if we're encountering them, but mildly? Of course, if it's severe, we need to see you.
Yeah. So tips, number
Yes.
one, exercise. Yeah, we preached that exercise today. We exercise, because when you're exercising, again, as we've said, it calms everything. You're stronger, your muscles are stronger, yeah? And you're able to carry you around the whole day, yeah? Exercising, sitting, the correct posture. Let's mind our postures, because the most all these other things, because of posture. And prolonged poor posture causes, yeah? So posture, mind our postures, yeah? When we sit, make sure you're seated straight. If you need to get an orthopedic chair, get, yeah? If you're sitting for too long, know that, what I advise my patients every day is, when you know this is your job, because every job has its effects on the body. When you know now is you have to know what to do to counteract that. Yeah. So let's not sit for too long. Yeah. Let's things like the heels, things like heavy bags. Yeah. Because there are ladies who, yeah, we are always with our heavy bags carrying the
keep their
whole world,
bottles and
everything, and then we end up with one shoulder higher than the
Oh,
other.
Velma, unachoma,
Yeah.
as they would say, unachoma.
Yeah, so if you need to carry your bag over here,
Yes.
yeah. So it's
Over here?
Yes.
Not here, Velma.
Not here.
Not on the back, even a rucksack.
Back rucksack is okay, but not too heavy.
Okay.
Yes, just
Oh,
reduce,
my.
and then reduce all those things. You don't need everything, Reduce the things, yeah.
Yes.
But things like that, yeah. It's just the simple things that we've talked about. When you're standing, mind of how you're standing. Just be cautious, yeah. You'll realize some of the things, because sometimes it takes a healthcare profession to just tell you, you know what, you're leaning forward.
Yeah.
Or you know what, you're really not straight, you're really leaning way back
Yeah.
than what you're supposed to be, yeah? So things like that. That's what, like the wallets we said, the
Yes.
crossing of legs we said,
Yes.
just the simple things. Yes.
Okay.
Yes.
I'm tempted to ask, are there foods that can help us avoid that?
Sorry?
Foods.
Foods.
Yeah, something we can eat just to.
No, just keep healthy. The diet is very important
Yeah.
because, again, if you're not having a healthy diet, what will happen? Your weight will tell us all. And of course, weight again is another thing, biggest thing that is also causing it will strain your back and cause all these issues, and even your joints. Yeah, it speeds up the process of arthritis and all that. So healthy, balanced diet. Yeah, we know what to avoid. We all know, we've all had it, but just eat a well-balanced diet. Yeah, not overdoing.
Not eating for two. For
Not
expected
eating.
matters, we eat
No,
for two.
no,
Just eat for yourself.
Just eat. That is enough. What the baby needs is just, you don't need to eat like a whole,
Yeah.
Yes,
Okay.
yes.
Okay.
Yeah.
Also talk about sleep as we conclude. You mentioned earlier in the discussion, you mentioned also sleep, rest. How does
Yes.
that contribute towards our body not having pain?
Well, yeah. Are you talking
Sleep.
about the positions or
Yes.
like the sleeping
Yes.
position?
Yes.
Yeah.
Can that help towards not having pain?
It can, yeah. So sleeping positions are also key. Sleeping on your tummy is not advised because when you sleep on your tummy, your neck has to be forced on one side, yeah. We can't sleep facing down like that.
Yeah.
So that over time, neck pains, yeah. And also it kind of reduces the curvature on the lower back, yeah. We don't need that. We need it to be in the correct, not exaggerated and not reduced, yeah. So sleeping on the side is what I would advise. Side and side, keep on turning. Yeah, don't overdo it on one side because sometimes you get people who are having pain on one side because we sleep. Everything will lean more towards one side. Balance. Let's create a balance. On the back, if you have to sleep on your back, make sure you're having pillows under your knees just to be able to keep your spine in a neutral kind of position. Yes, yes.
Sleep on the back pillows.
Pillows under the knees.
Okay, so
Yeah,
I'm
because
looking up, I put pillows under the knees. Why?
Yes, just to lift and raise. When you sleep flat, you realize that there is a curve on your lower back, right?
Yes.
So
Actually, you
meaning,
can pass.
Yeah, you can actually put your hand through it.
Yeah.
And that's meaning that the spine is not at a neutral position. Yeah.
Yes.
So when you put pillows under the knees,
knee.
so it raises up, and now it's a bit more flatter on the bed.
Yes.
You're getting me?
Yes,
So now that's more neutral, and that cannot give you issues. But when you sleep, you're not supporting the back.
Okay.
That curve on the back. Yes.
And those who lift, they fold your knees like this. You're sleeping on the back, but you fold your knees. Does it help so that you feel like your
That
back
will
is
help,
straight?
but then how can you really maintain that when you're sleeping? How long can you keep up with that?
Okay.
Yes.
We have to wrap it up, but a question had come to my mind. Maybe you could answer in a second. What about the generation that wears really tight clothes, extremely tight? Can it lead to some muscle pain? Anywhere. Masbwembe.
Kidogo, maybe because of restriction of blood flow. Yeah, because if you're wearing something really tight, you'll just feel the uncomfort because maybe the blood is not able to flow as it's supposed to be, but
Yes.
really not
so
much.
Okay.
Yeah.
Neither here nor there.
Yes.
Thank you,
Yes,
Velma.
yes.
We really appreciate you for finding time to join
Asante
us.
sana for having
Thank
me.
you
I
so
really
much.
appreciate.
Yeah, we look forward to hosting you again.
Awesome.
Okay. She's called Velma Mokeira, a physiotherapist. Hope you've enjoyed the discussion this day and you're going to apply the many things you've learned. Actually, you need to see a physiotherapist once a month. You've learned that today just to ensure that your body is okay. When you feel that pain, don't assume it. Go be checked. And of course, she'll also be able to refer you. Any other physiotherapist will refer you if there is need for referral.
Yeah.
My name is Grace Putiso. Wish you a blessed night. And allow me to say goodbye as I take a short break. God willing, I'll see you again just after a short break. I'll be back so that we continue serving together with you right here on Health Check. I have an excellent person coming to sit in for me while I'm away. I wish you a blessed time. God willing, we meet again. Stay safe. Keep it Health Check. Keep it Hop TV, where you look and live. Shalom, and may God keep keep you and bless you. Bye bye for now.